Look, thanks for having us, Kieran. Look, last year was the worst year we've had for domestic violence in this country on record. And the issue is that demand for services is not letting up. Frontline domestic and family violence specialists from right across the country are saying that they are slammed right now. And for example, the Women's Domestic Violence Court Advocacy Services in New South Wales provided an additional 73,800 occasions of service to women last year in New South Wales alone. That's an increase of 35%. So at this juncture, when we've never seen demand this high, what we're calling on governments to do today is to recommit that supplementary funding during COVID that they provided that was so welcome at that time.
So that's for the frontline services like yours. But why do we see this disconnect? Because for the last couple of decades, we've seen all the major crime numbers come down in most categories, except this one. Why is that?
Yeah, look, it is an intractable problem. It's going to take a whole of community solution to actually stamp it out, but it has to start with leadership. At the end of the day, this is the single biggest issue facing women's health. It's a single biggest preventable driver of death, of disability and of illness in women aged 15 to 44 years of age. It's a massive problem. And I think that finally the federal government is getting the message that we're going to have to start putting some serious resources into the evidence-based solutions to make sure we get some ground. At the moment, the federal government has been investing a little over $100 million a year to tackle this crisis, but that's nationwide and it doesn't go far enough. What we on the front line are asking for is reinstatement of that $150 million to just take the pressure off right now on frontline services. But for the next national plan to reduce violence against women and their children from 2022, we want to see $1 billion a year investment in turbocharging the solutions that we need to actually start to see a reduction in violence against women and children in this country.
So what are the solutions that work? From someone who works in this space, I mean, what needs to happen for a woman and children who are in the face of domestic violence? They need to get out. What sort of support mechanisms are most effective?
Yeah, look, what we're seeing at the moment is a national campaign to raise awareness about domestic and family violence and what it actually is, what are the red flags. And we're actually encouraging people to come forward for support, which is fantastic. But that's working in the sense that more people are coming forward. We need to make sure that when they do, that the services are there to support them. Things like making sure that there's crisis services, case management services to support them to make that journey to safety, accommodation services, services to support people to stay home safely, services for legal services to support them through their legal issues, specific services for Aboriginal and Torres Strait Islander groups, LGBTIQ groups, culturally, linguistically diverse, and women with disability that we know are really highly impacted by violence. So there are many, many measures that we need to invest in. That, look, unfortunately, it's almost like Swiss cheese, the amount of gaps in the service system. We need to make sure that we have a universal approach to this. It shouldn't be a privilege to get access to support when you're trying to escape violence. It should be a universal right, no matter where you live, no matter what postcode, that you can access those services. And that goes as well for people who are using violence in their relationship. We need to make sure that the services are there to support them as well. And look, that's the service. That's making sure that services are available. There's much, much more that we can do as well that isn't going to actually hit the bottom line so much as well. Things like creating a national definition of domestic, family and sexual violence, having stronger data collection mechanisms, clear targets, a stronger bottom line in terms of our criminal justice response. And all of those things combined with proper resourcing is what it's going to take to really get the rubber hitting the road and really start to see some reductions in violence against women and their children.
We're expecting the government to respond to the Respect at Work report by Kate Jenkins, the Sex Discrimination Commissioner, handed it over a year ago to the government. One of the key suggestions is that employers have to have the onus upon them to deal with any issue like sexual harassment. Within that report and the recommendations, is there anything that stands out to you in terms of what needs to be done in terms of workplace safety and gender equity in the workplace?
Yeah, look, that's a fantastic report. It is a shame it's been sitting on the shelf for so long, but we now have an opportunity to act on those. I think the critical message is that this is a whole of community problem, and it does require a whole of community response, and that includes workplaces. Workplaces can be doing so much more to support their own workforce when they're experiencing domestic, family, and sexual violence, but they can also be doing things to tackle it, like you said, have more gender equity in their boardrooms and those in decision-making positions. That's absolutely critically important because we know that the drivers of violence against women really are around those gender, stereotypical ideas about roles and expectations, amongst other. We know there are a number of other triggering factors as well. So, look, it's really positive to see that there's going to be a focus on what workplaces can do as well. But we must also acknowledge that the most dangerous place for a woman and her children to be in this country is actually in her own home. And I think that's a sad indictment that women and children can't expect safety at the moment in their own homes. And really that needs to be the priority.